The big question is, can we make people live longer?
Is this the future? It is part of the future for sure.
When they told me it was a glioblastoma, I knew it wasn't good.
I'm Roger Stupp.
My name is Adam Sonabend, and I am a brain tumor specialist. I also lead a brain tumor research lab. We are investigating the use of this technology to deliver immunotherapy for patients with glioblastoma.
The blood-brain barrier is a physiological barrier that prevents drugs or toxic agents to touch our brain, which is good. This is protective. But when we need to have medications to get into the brain, then it's an impediment to successful treatment.
I can remove the bulk of the tumor, but just like an iceberg, there's always more underneath the water, if you will.
So the device was developed in France. So we brought it to Chicago in 2018.
Dr. Stupp and I were asked to be involved as part of a clinical trial when we were fortunate to get National Cancer Institute funding from the NIH.
Dr. Sonabend came in and said, I have a study that's going on that will implant a device in your head, and through ultrasonification we can get chemotherapy that'll cross the blood-brain barrier.
I first learned about Dr. Sonabend's research in an article in the Chicago Tribune, and it really struck me because this glioblastoma is something I know about. I lost 3 friends, John McCain, Ted Kennedy, and the third, Bo Butt. So we reached out to him. I said I want to learn more.
So this device is basically a grid of 9 little speakers mounted into a titanium mesh.
A piece of the skull is taken out and this is implanted.
Patient goes home. And when we want to open the blood-brain barrier, we just put a needle through the skin connected to this port. We inject the microscopic bubbles, and within 4 minutes, the brain has become permeable.
We can give the drugs we need to give. They will also be trapped in the brain.
So you really have about 1 hour to get the blood levels of whatever drug you want to get into the brain really high.
4 to 6 or maybe even 7 times the concentration into the brain than if we would not have opened it.
When we're doing this trial, we learned, contrary to what was previously believed, that when you open the blood-brain barrier, the brain can repair itself within an hour. And that was fascinating.
The results have been encouraging enough to attract capital to fund it. They've been encouraging enough to have 2 biotech companies and Northwestern join forces to take this to the next level.
I've been involved in funding medical research through the National Institutes of Health, but glioblastoma, of course, was one aspect of the research, and I was happy to see that Northwestern was taking the lead on that.
Research is one of the things that gives you time, and as a cancer survivor, all you want is time.
We have this clear bridge between the laboratory and the research, and we really excel moving new ideas rapidly into clinical use.
There's this fluid transition back and forth between the lab, the bench, and the bedside. And I am very, very fortunate to walk between these worlds and translate things.
Last but not least, this is going way beyond glioblastoma.
So as 95% of the drugs don't get into the brain, this device opens the possibility of repurposing 95% of the drugs that are already out there for treating neurological diseases. Epilepsy, Parkinson's, and dementia.
That's why it's so important that Northwestern Medicine and Northwestern University are doing that right here in the Chicago area.
Disruptive thinking is really what has moved oncology from where I trained to where we are today. That's our daily task, to really push the boundaries. At a place like Northwestern, we can do that.
I've gone to a wedding in Florida. I'm not living, and it's all because of the research that they did here at Northwestern Medicine.
I had sleepless nights. When we started that project, I had sleepless nights. I sleep better now.